Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about diagnosing fatigue and unraveling the mystery. The universal complaint, understanding fatigue. It's more than just feeling sleepy. It's a persistent lack of energy, often accompanied by mental exhaustion, reduced motivation, and an impaired capacity for daily activities. Because it's so universal, it can be easy to dismiss, but persistent fatigue always warrants investigation. This algorithm aims to systematically uncover the roots of this pervasive complaint. Phase 1, initial assessment, listening and looking. Patient history and subjective assessment. Its onset, acute versus chronic, pattern, constant versus intermittent, and the time of day, and severity. We review associated symptoms across all body systems, conduct a detailed medication review, including over-the-counters and supplements, assess lifestyle factors, sleep, diet, exercise, stress, substance use, and explore psychosocial history, recent life events, mental health. Basic physical examination. This involves taking vital signs, assessing general appearance for pallor and weight changes, and conducting focused system exams, cardiovascular, pulmonary, abdominal, neurological, musculoskeletal, to look for objective signs related to the patient's complaints. First tier investigations, core lab work, complete blood count to screen for anemia, infection, or blood disorders. Thyroid function panel to assess for hypothyroidism and hyperthyroidism, common causes of fatigue. Blood glucose and HbA1c to screen for diabetes or prediabetes. Comprehensive metabolic panel to assess kidney and liver function and electrolyte balance. Inflammatory markers, CRP, ESR, to indicate general inflammation, which can point towards autoimmune or chronic conditions. Vitamin D, vitamin B12, and folate to identify common nutrient deficiencies that severely impacts energy levels. Foundational interventions and lifestyle first. Optimize sleep hygiene, establishing a consistent sleep schedule, ensuring a dark and cool sleep environment, and addressing sleep disorders. Balanced, nutrient-dense diet. Counseling on whole foods, adequate protein, fiber, and proper hydration. Appropriate exercise, guiding patients towards regular, sustainable physical activity. Stress management techniques, mindfulness, relaxation exercises, and strategies to cope with chronic stress. Medication review, collaborating with prescribing physicians to identify and adjust any medications that might be contributing to fatigue. If a clear medical cause was identified in the labs, specific treatment for that condition is initiated concurrently. Phase 3, second tier investigations, deeper dives. Sleep study to diagnose sleep disorders like sleep apnea, especially if snoring or excessive daytime sleepiness. Adrenal function testing, such as salivary cortisol diurnal curve, to assess for hypothalamic pituitary adrenal axis dysfunction. Sex hormone panel, assessing testosterone, estradiol, progesterone, and DHEA. Infectious disease serologies. If specific chronic infections, for example, Epstein-Barr virus reactivation, Lyme disease, hepatitis C, are suspected. Autoimmune markers. If inflammatory markers remain elevated or specific symptoms suggest an autoimmune condition. Gastrointestinal evaluation for malabsorption or gut dysfunction, potentially including celiac antibodies, comprehensive stool analysis, or small intestinal bacterial overgrowth. Breath tests. Heavy metal toxin screening. If environmental or occupational exposure is a concern. Psychological assessment and specialist referrals, screening for and diagnosing depression, anxiety disorders, chronic stress, and burnout, which are major contributors to fatigue. Referring to a mental health professional, psychologist, psychiatrist, therapist for comprehensive evaluation and treatment. Additionally, based on findings from the second tier investigations, referrals to other specialists become necessary. Endocrinologist for complex hormonal imbalances, sleep specialist for diagnosed sleep disorders, rheumatologist for autoimmune or chronic pain conditions, gastroenterologist for complex GI issues, neurologist for persistent neurological symptoms. Phase 4, beyond the obvious, complex diagnoses, myalgic encephalomyelitis, chronic fatigue syndrome, a severe, debilitating, and persistent fatigue not explained by other conditions, often triggered by infection. Mitochondrial dysfunction, impaired function of the cell's powerhouses, leading to energy production issues. Environmental exposures, further investigation into environmental toxins or mold exposure in damp buildings, though caution is advised regarding unvalidated tests for toxic mold syndrome. Conclusion, a multifaceted challenge, a holistic path. The algorithm provides a structured framework, but success lies in a holistic, integrated approach. Patient education, empowering individuals to understand their body and participate actively in their care. Multifactorial management, addressing all identified contributing factors concurrently. Regular monitoring, continually reassessing response and adjusting interventions. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to my channel.